want to help people to stay well for longer by doing more to support them to look after their own health and well-being. This includes preventing ill health and tackling inequalities by services working together and by harnessing the potential of digital technology. Raised blood pressure is the greatest risk factor in cardiovascular disease, which includes heart attacks and strokes.
Raised blood pressure may not produce any symptoms and is associated with an increased risk of heart disease and strokes. So many people may not know that they have undiagnosed high blood pressure or hypertension.
It is also the largest cause of the life expectancy gap between the least and most deprived areas in Sussex. Fortunately, hypertension can be prevented and managed by checking blood pressure regularly and through treatment. NHS Sussex and Community Pharmacies Surrey and Sussex have developed a new way of working between pharmacies and GP practices to detect more raised blood pressure in people and who might not be aware they have it. A text message system was developed which will send bespoke and secure messages to patients. In a pilot of the service, patients over the age of 40 and those that had previously raised blood pressure recorded at their GP surgery were invited via text message to check their blood pressure, either using a home blood pressure monitor or by visiting a participating pharmacy.
Community Pharmacy Blood Pressure Service is an advanced service which was commissioned in October 2021. This service has two elements. One is the opportunistic testing, where pharmacists can test patients that are over 40 or, if eligible and the criteria is met, under 40 with no diagnosed hypertension. The second element of the service is for GPs to refer any existing patient on the patient base into the service, regardless of condition or medication taken.
If high blood pressure or hypertension is confirmed at a pharmacy checkup, then patients receive treatment from their own GP to bring this to a target pressure to reduce the risk of cardiovascular disease. In the pilot, almost 2,700 text message invitations were sent to people to provide readings. This resulted in 77 patients being diagnosed with raised blood pressure or hypertension, which was then managed by their GP. These cases may have been previously otherwise undiagnosed and meant that the person was at risk of worsening health.
We've actually managed to roll out to 9 primary care networks or PCNs and have supported 38 GP surgeries with this work, and we're very much looking forward to building upon this. It's the first project really where we've seen a collaborative process between community pharmacies and GP surgeries. We feel that it can significantly increase capacity within primary care.